Hi, welcome to our channel of ignou audiobooks, Indira Gandhi National Open University, School of Social Sciences, SOSS, Master's Degree Programs, MA in Psychology, MAP, Second Year, MPCE 0 to 2 Assessment in Counseling and Guidance, Block-2 Approaches to Assessment in Counseling, Unit-1 Interview, Case History and Testing, 1.0 Introduction. There are various assessment techniques in counseling and guidance. Interview, case study and psychological testing are popularly used for assessment of the client. These techniques enable the counselor to obtain specific information and to explore behavior or responses in depth. Interview is a conversation with a particular purpose. We have seen and are aware of the selection of candidates through interview and other assessment methods, and we also know how the employee's interview is taken. These interviews are of different types, as for instance some are structured, some unstructured, and some others semi-structured, and so on. The intake interview is one of the most important interview which takes place in the first contact of the client with the counselor. Depending upon the purpose, the most appropriate type of interview is selected. In counseling, all forms of interview are used. Case history taking requires one type of interview. Often it is in standardized format. Psychological testing is objective measure, which is used to assess the client. To measure personality, aptitude, intelligence, and interest, etc., psychological tests are used. All these tools help the counselor in diagnosing the client's problem. In this unit, we are going to discuss some features of interview, case history and psychological testing. 1.1 Objectives. When you have completed this unit, you will be able to times define interview as a method of counseling, times identify some of the characteristics of interview, times explain different types of interviews, times explain how interview skills are acquired and developed, times describe the role of interviewee and interviewer, and times analyze the various sources of error in the interview. 1.2 Interview. Interview technique is widely used by the psychologist for increasing counselors' understanding of the client. It enables the counselor to obtain specific information and to explore behavior or response in depth. In many respects, an interview resembles tests which has reliability, validity, prediction, and structure. The interview remains one of the most prevalent devices in clinical, industrial, counseling agencies, schools, and correctional settings. This technique is important since this is scientific in nature. Interview is interaction between two or more people. The situations may differ. In some interviews, it is one-to-one interaction. In others, it might be that a single person is taking interview of many people at the same time, like family interviews that are conducted for therapy. 1.2.1 Definition of interview. Interview is a method for gathering data or information about individual. Kaplan, Sakazo, 2005. Thus, interview is conversation with a purpose. Conversation may not have purpose and start anywhere and stop anywhere without assignment of specific role of individuals interacting. Although there are many types and purposes of interview, all share certain factors. Now we see some characteristic of interview method. It is different from conversation in a number of aspects. Refer to table below. Table, differences between interview and conversation. Look at the screen. 1. 2.2 Characteristics of interview. To understand the basic concept and characteristics, we will discuss some essential features of interview. 1. Attitude of interviewer and interviewee. If the interviewer is understanding and genuine, then it is likely that the interview will be more valid. Also, as pointed out by some experts, communication and assessment are important functions of interviewer. It is the responsibility of the interviewer to direct and continue interactions. The interviewer should be an expert in this field. Many times clients do not return for a second session, and this may be related to the interviewer's skills. For example, while taking case history, if the counselor is understanding and genuine in interaction with the client, the latter will be more comfortable and will become less inhibited and thus open up with the concerned problems, personal and impersonal, in the interview situation. On the other hand, if the client senses that the counselor does not understand the problem and appears insensitive, then the counselee may refuse to part with much of the information relating to the problem and thus will leave the counseling session halfway and leave. Thus, the climate built during the interview influences the degree of client's willingness to disclose personal information. Whiston, 2009. If the interviewer has to obtain the required information from the interviewee, then it is essential that the counselor establishes adequate rapport with the client. Interviewee should have the ability to communicate, translate the emotions and thoughts into words, and organize thoughts. The client is expected to be cooperative. 2. Proper atmosphere. In order to help client feel comfortable, the counselor has to create a congenial atmosphere, both physical and emotional. Physically, the room should be pleasant, well aired, with privacy indicating that the client can talk whatever comes to mind without any hesitation. In the interview, the counselor should avoid certain questions which may cause embarrassment to the client. So also the counselor should avoid certain responses that may put off the client and make the client clamp up. In fact, the interview should be smooth and not probing or inquisitive. That might also put off the client. For example, if the person who is interviewing is found to be probing, hostile or judgmental, then obviously client will not feel comfortable and thus withhold the needed information. It is very essential to be sensitive to the feelings of the client during the interview. Also, if during the interview the interviewer tries to give false assurance, then that may make the other person uncomfortable. This will also decrease the respect for the person who is interviewing the person. It is not always necessary that people seek some solution when they are mentioning their problems to someone. The responses of criticism, arguments, an authoritarian approach, etc. should be avoided. 3. Interviewer's effective response. Some responses that are encouraging are required. Interviewer should serve as an understanding listener, allowing client to talk freely, treat what is being said in its context, and ask questions only at appropriate times. Open-ended questions are more effective in the interview. It is important that the interviewer keeps aside the biases and conducts the interview. One may not necessarily agree to the content of the material that is produced in the interview. Nevertheless, the interviewer should encourage the client to continue what he or she was saying, keep the conversational flow going. 4. Measuring understanding. A great deal of research has been carried out by Carl Rogers in this regard. He has analyzed the responses that are given by the client to classify them on 5 levels. The basis for this is the empathy by that person. If the person has more empathy, then it is likely that he will have higher level of understanding of the client and his or her problems. Level 3 and 2 are adequate for conducting the unstructured and semi-structured interview. 5. Recording responses. Responses of clients should be taken in some form. It can be taken in detailed writing while interview is in progress. It has an important advantage in that the client may feel that whatever is being conveyed by him/her appears important, as whatever the client says is being recorded by the interviewer. This encourages the client to part with more and also in-depth information. If whatever the client says is not noted down immediately, the possibility of the counselor distorting or forgetting certain information that the client gave is high, and this can be avoided by writing it immediately. However, writing down the information immediately has also certain disadvantages, and these include the cutting the flow of communication by the client. Recording can also be through electronic devices. In such recording, a microphone is placed in front of the client with the client's permission. Yet, such a device, which is recording all that the client wants to convey, may make the client feel uncomfortable, and thus the client may not be as uninhibited and free as he or she would have been otherwise. Hence, the interview counselor should make sure that the client not only has no objection for recording the narration but will not feel uncomfortable to talk freely. Ethically, too, this prior permission for recording is a must. Also, it must be ensured that the client, if need be, should get a choice to put off the recording, which is considered by the client as confidential. If the counselor chooses to write down whatever is being told by the client, the same may be done by noting down points and not verbatim or in detail. 6. Interview is different from communication. The interactions of two or more people in the interview session are very different from communication. As mentioned earlier, interview is interaction with purpose. Communication may not have any purpose. It starts anywhere and stops anytime because of lack of purpose. In interview, the role of interviewer and interviewee is specified. Interviewer has the responsibility to continue the interview and also direct the interview. 1.2.3 Types of interview. Interviews are classified in different categories depending upon the procedure employed. Here we will study 4 important types of interview, i.e. structured, unstructured, semi-structured, and intake interview. Case history interview is discussed in a separate section.
Let us begin with structured interview. A. Structured interviews. As the name implies, the structured interviews are the ones in which interviewer asks a pre-planned set of questions in the same manner and sequence for each client. This method is used when same information is required from all interviewees or for getting information from the same client on other occasions. The questions that are asked are structured and standardized. These are objective questions, irrespective of the fact who is being interviewed. These are followed by everyone. The sequence of the questions is also important. And to conduct this type of interview, it is necessary that the interviewer is properly trained in this skill. There are clear-cut guidelines given how and in what sequence the questions should be asked. For example, take the Clinical Assessment Questionnaire that is given by the DSM-IV classification system. The interview is quite structured here and requires the interviewer to follow a very clear guideline relating to particular disorder. Each disorder has different criterion and accordingly the questions are formed. To conduct such clinical interviews, the person concerned should get formal training in the clinical setup. Otherwise, the data collected by this method is not taken as valid. Information collected by this method can be organized easily, and comparison between responses is possible, because the interview questions are in written format and clearly structured. One important advantage of structured interview is that certain words which might otherwise be used can be avoided, as it may cause problems during interview. Because it is so structured that it is considered more reliable and valid. A major limitation of this method is that it relies exclusively on respondents. B. Unstructured interviews. Unstructured interview is opposite to structured interview. The interviewer may have an idea about possible questions, but depending upon the needs of the client, the order and sequence of questions can be changed, modified etc. by the interviewer. Certain questions which may not be very relevant or wrongly worded can be modified by the counselor. During the interview, if the counselor finds that certain questions need to be added or deleted, the counselor may do so. Thus, questions are asked as per the flow of communication. Due to this freedom in asking questions, more spontaneous responses are given by the client. The major advantage of this method is flexibility. Example of this type is the interview that is conducted by the media on the opinion of the common man on certain issues. They address the issues that are important to the common man, but that does not assure that the information that is gathered is always valid. They may just hide the information that does not fit to their belief system. However, unstructured interviews are less reliable and more prone to error than structured interviews. C. Semi-structured interview. Many times semi-structured method is used to minimize the disadvantages of both methods. It is a combination of structured and unstructured method. Certain questions are always asked, but there is freedom to add questions. D. Intake interview. The initial interview is the first meeting in which interviewer works with client to gather information about the problem with which the client has approached the counselor. This interview includes presenting problem, general life situation, history and interpersonal functioning. Sometimes it is called as history interview. The basic purpose of this interview is to get information about the client and their problems. In most of the cases, the provisional diagnosis is made on the basis of this information. This is an one-to-one interview technique, in which the counselor tries to gain as much information as possible which would help the counselor to formulate the problem and understand the causes leading to the problem. The interview is directed by the counselor throughout, and it should be done in such a way that the counselee is able to talk most of the time expressing the problem that is bothering the person. If the interview is too direct, the directness of the counselor's questions may make the client take a passive role. The way the interview is structured also affects the interview and gathering of information. For instance, too much of structuring may give the clients an impression that they need not give any information on their own, as the counselor will in any case ask them about all these aspects. The other limitation is that the responses of clients are given before counseling relationship development and may not be accurate. Counselor has to re-examine this information once rapport and trust have been established. Another aspect in interviewing is that the questions should not be repeated lest the client just bored talking about the same thing over and over again and possibly delete some of the details. Hence, every effort should be put in to see that the interviews are conducted in a manner that not only the counselor is able to establish trust and confidence on the part of counselee but also make the counselee feel so uninhibited that the latter expresses even the most unpleasant experiences to the counselor. 1.3 Case history interviews. After initial interview, in-depth information is gathered by case history interview. This is type of structured interview with the focus of getting the details of the patient's life. History taking is important for diagnosis and therapy. This method of interview will be discussed here in more details. 1.3.1 Basic issues in case history. Each field of science has different way of taking history. The way in which the lawyer takes the case history would be different from the medical professional. Each field has a particular format of the case history. This not only gives the understanding of the current status but it also helps us to have understanding about the factors that have caused development of those symptoms. This is life sketch of the person. The background and the etiological factors are obtained in the process of case history. The rapport is established while taking the case history. If the interviewer is a good listener, then there are more chances that the client will give details about himself. In the first part of case history taking, details about demographic information such as name, age, gender, residential address, education, occupation, marital status etc. are taken in detail. All the minor things like where he stays and the area, all these things are mentioned in details. Then details about who has referred him are taken into account. All these information may not seem quite useful at face value, but with increasing experience we understand that this information can be used later for the management of the case. The next part is about the referral. Who has referred this person? The next information is about the actual problem that the person is facing right now is taken. The sequence for this purpose is in the order that the complaints have started. Details about how these symptoms started, how they progressed and what is the duration of this, etc. are all mentioned. To understand if the person had difficulty in developmental years, the details about this are taken. The person is asked about his schooling and the education. By the time the counselor reaches this point, he is oriented to the kind of personality the person has. To utilize the information constructively, this information is very important. This is clinical evaluation of the personality. In most of the cases, the tests are not administered at this point. If a formal assessment is needed, then the referral is made at a later stage. Then the interviewer asks about the medical history if any. As a psychologist, we may not be aware about the details of some of the serious physical illnesses the client might have suffered from. As is known, physical illnesses also have an impact on the mental status of the client. However, we can judge the psychological impact it has on the client. In this aspect, information centers about the illnesses, and also what treatment has worked so far, for that person. The next issue relates to the person's interest and attitude towards life and other related aspects. This is mentioned in the case history. This will also include the client's political and religious belief system. This includes what the person prefers when he has free time. The other important aspect of history taking is mental status examination. This is also called present status examination. In this, the examiner tries to confirm the information that he has gained in the previous part of the case history. The points like person's appearance, his speech and thoughts are at the beginning of this section. Then it is also considered if the person was able to attend and concentrate on the interview. The other important aspect is regarding the pathology. The speech sample is mentioned. The examiner also asks specific questions to evaluate if the thinking normally. According to the phenomenology, certain questions about the hallucination and delusion are asked. The person is evaluated on this dimension. In the mental status examination, it is also essential to assess if the person is suicidal if he has had any previous attempts. Overall, this segment of the case history taking leads to the diagnosis. And if not diagnosis, at least the clinician is able to reach the provisional diagnosis.
1.3.2 Case history taking. Format 1. Identification data. Times name. This is necessary, but in certain cases, it is necessary that we assure them that their name will be kept confidential. Sometimes the client does not want to reveal their identity. The clients may belong to some well-known family or some prestigious family, so they do not want to tell their name, time, sex. This helps to understand the person with better cultural perspective. There are specific roles that are assigned to each gender. This is the importance of this aspect. Times age. The age of the person helps the clinician to understand the developmental phase that he goes through. Each phase has a developmental task. The person's age gives us understanding of the growth of that person. This tells us if he has attained all the tasks at the appropriate time. Times education. The education tells us about the person's exposure to the external literate world. This is important also because, as a clinician, if there are any references in the form of reading that we want to suggest, education of the person does not always indicate he or she will be reasonable, logical and rational. Time school institute. The school is the first social experience of the person. He understands the rules that are set by the institutions and that he has to follow them. In that perspective, the information regarding school is important. 2. Problem stated by client. What does the client think about the problem is very important. Others may perceive the problem in different ways than how the client looks at it. Since the client is the one who has to deal with the problem, it is important that his understanding is shared with the counselor. Informant. This information is given by the person who accompanies the client. He gives how he perceives the problem that is experienced by the client. These two may not always match with each other's. These two may have different ways of looking at the same thing. Others, in certain cases, it is important that the information has to be gained on some additional aspects. For example, if the client is working at a firm and has problem working there due to anxiety, then information regarding this has to be obtained from the employee. 2. Duration of the problem. The details of the problems are taken into account. The onset and duration of the problem. In most of the cases, the problem arises after there is some stressor. So the details of how the problem started are asked to the client. 3. Intensity of the problem. The intensity of the problem will decide the actual therapy that is to be used. This also tells us the urgency that the client has for the intervention. 3. Personal history. Times birth and development. The informant is asked about the details of the birth. Since we know that delays in attaining the developmental milestones are the good indicators of the intellectual subnormality. The ordinal position that the person has born with affects the development of the personality. Times school history. This is the institute that the child first time faces in his life. The school experience does have an impact on the further education of the person most of the times. It is not always detrimental in the development of the person, but it shapes the experience of the person. Times medical history. This is not to merely make sure that there is no medical basis for the symptoms, but it is more to understand the limitations of the person. The person may develop certain symptoms as a result of some other physical illness. For example, a person who meets with an accident develops phobia for the open places, then this is secondary to the medical history that the person has. Times social history. The social development of the person tells us many things. To what extent the client is related to the community. His position in the community is indicated by this. This also is a good indication of the social support that the person has. The social development is helpful in understanding the impact of culture on the person. Times emotional development. This aspect tells us the person's capacity to deal with his problem when the counselor suggests it. This is the basis of the person's personality. The emotional development is a process that enables the person to deal with the matter and stress effectively. This tells us whether the person is emotionally behaving appropriately. Times premorbid personality. This is the personality of the person before the actual onset of the problems faced by the client. It includes his interests that he had and what was his attitude towards himself. These assess what are the ways in which the person copes with the stress. This becomes the basis for the counselor to design the intervention for the client. Times the client's fantasy life. This is one more aspect on which information is obtained. This tells us about the motivations and deprivations of the person's life. The details of the daily life are also included in this. Times sexual occupation history. This is the information that is taken carefully from the client. The client may not be able to talk comfortably about the sexual content. Due to the impact of the culture, these are topics that the client may not prefer talking to openly. It will depend upon the rapport that is established with the client. The occupational history throws light on the client's overall personality. 4. Family history. Family is an essential source of personality and development, and also in many cases source of frustration. Therefore, what are the family ties? What is structure of the family? Times family constellation, relation, age, education, occupation, times socio-economic status, the income of the family, the place where they live, the kind of work that they do, the kind of status they have in the community in which they live, and many such related aspects are important to understand. Times relationship with parents. This is especially very important when we are dealing with adolescents' problems. Family is the first and important unit in the person's life. This shapes many relations in life. This can be asked to the client and should be confirmed with the parents also. Because it may happen that the client perceives his parents in a misconstrued manner and thus forms an image of them as supportive or non-supportive towards self. This perception may be quite different from the one that is factual, in that the parents may not be at all as the client perceives them, but may be doing things with good intention. Exactly opposite may also happen, that is, a person may have a false image of his parents. So in both the cases it is very important that we confirm it with reliable source of information. Times interpersonal relationship. Within family, this is an important aspect of the family dynamics. How the family members relate to each other is important. The client may not be the victim of the conflict, but he may witness it with some other family members. So this becomes important to see how much the emotional tie is strong with the family in case of the client. 1.3.3 Mental Status Examination. The mental status examination, MSE, has been used predominantly in psychiatry, clinical psychology, and psychiatric social work for several decades, but is being increasingly used by counselors in work settings requiring assessment, diagnosis, and treatment of mental disorders. The MSE is used to obtain information about the client's level of functioning and self-presentation. Generally conducted, formally or informally, during the initial or intake interview, the MSE can also provide counselors with a helpful format for organizing objective observations of clients and subjective data provided by clients, information to use in diagnosis and treatment. This is the evaluation of the client at the time of the interview. The clinician completes taking the case history. Then he reaches a tentative diagnosis on the basis of the information that is provided by the client and the informant. Now, this is the evaluation that tries to confirm the diagnosis. Based on a diagnostic system, the clinician asks questions. This helps him to come to a conclusion about the diagnosis. This also confirms the clinical understanding of the symptoms that are given by the client, times behavior, the behavior of the client, if it is age appropriate or not. How does the client behave with the examiner? What is his attitude towards the examiner? These are all the points that are included under this heading, times. Thoughts. The thoughts are significant in two important ways. One is, assessment of these will tell us more about the personality of the person. Second, and very important, is that it will also tell us if the person has any disorder of thoughts, times speech. This is related to the quality of speech of the client. The volume, tone, and other things are good parameters of the speech quality, times perception. These are related to all the five senses of the person. Questions regarding this tell us if the person has any illusion or hallucination. This will tell us about the intensity of the problem the client is facing. Higher mental processes, times intelligence, this is the key factor. It helps the client to understand his own problem. If the person is aware about his surroundings and what is his general level of knowledge is the indication intelligence. If there is any indication of low subnormality, then a particular test may be administered to assess the intelligence, times memory. This is also important aspect of intelligence. But this is at the same time an indication of the brain functioning. Disturbance of this is an indication, times attention. This is one more indication of the brain functioning of the person. Disturbances of attention may be an indication of some problem at brain level functioning, times concentration. As mentioned above, attention and concentration are related to each other. If the attention can be sustained, it is called as concentration.
Insight. This means the person understands of his state, whether he has any understanding of his illness or not. Psychological examination in the following format. The test that has been used for the assessment can be mentioned in an organized manner. This gives us quick understanding in summary of the test administered. Integrated note with theoretical base. This is the summary of the interview that is conducted by the clinician so far. This leads to a diagnosis. These are usually the positive findings that support the diagnosis. Diagnosis. This is the final understanding about the client. According to the classification system that the counselor follows, he will diagnose the client. There are two widely used systems as we know. One is DSM-IV and other is ICD-10. Since counseling is for normal people, above two systems are not used. In counseling, different classification is used such as study problem, adjustment problem, negative self-concept etc. So with the help of the case history and the mental status examination, the client is diagnosed. Diagnosis helps to know symptoms, etiology and therapy planning. Prognosis. This gives us a clear understanding of what are the chances of recovery. There are few factors which are asset for recovery while some are negative. Counselor considers good and bad factors and decides the probability of recovery of problem. Counseling design, choice of therapy. After understanding all the essential aspects of the client's problem, this is the time to actually do the intervention. The problem that the client is facing can be treated in different ways. It is the skill of the counselor to convey to the client what he has understood about him in the language that the client understands. At this stage, with the mutual convenience of the client and the counselor, the further contracting for his therapy or counseling is done. The counselor shares this with the client. If there is any need to involve someone in the counseling process in addition to the client, that may be conveyed to the client and to the family member who is to be involved in the program. 1.4 Psychological testing. What is a test? A test is a measurement device or technique used to quantify behavior or aid in the understanding and predicting the behavior. We all do appear for such tests many a times in our lives. The situations may differ, right from the interview that one faces as a child for the school admission till interview as a parent. We all have experiences of appearing for the test in the formal atmosphere, as for instance the job selection tests. These tests will be considered in detail in the next section. Thus, tests in general do scrutinize and give us fair idea about the person's performance for a particular position. This predicts the person's behavior in that situation. Many tests are devised specially with the purpose of getting the objective information from people in particular area. Also, specific tests have been devised over a period of time by different experts, which focused on a particular aspect of the person. For example, tests were devised to understand the person's ability to appreciate and understand music. The journey of the testing started from the objective evaluation of intelligence and reached very minute but essential aspects of daily life. A wide variety of tests have been devised for the purpose of recruitment during the Second World War, since this was the immediate requirement after the economic recession. 1.4.1 Definitions and Characteristics of Good Psychological Testing, 2008. A psychological test is a standardized procedure to measure quantitatively or qualitatively one or more than one aspect of a trait by means of a sample of verbal and nonverbal behavior. Anastasi and Urbina, 2003, defined psychological tests as follows. A psychological test is essentially an objective and standardized measure of a sample behavior. Thus, a psychological test is a set of items that are designed to measure characteristics of human beings that pertain to behavior. The behavior could be overt or covert. The above definitions give salient features of psychological tests. Psychological tests are standardized measure, objective in nature, measuring some sample behavior, useful for quantitative or qualitative trait. There are some criterions to call any test as good psychological test. These are the parameters on which the test is judged if it is scientifically useful or not. A. Objectivity. A test should be objective. Test should be free from subjective factors. There should be objectivity in test construction, scoring and meaning of the scores. If IQ, intelligence quotient, of any individual is between 90 to 109, it will be considered as average all over the world. Thus, subjective judgment of any examiner will not affect on the scoring and interpretations.
B. Reliability. Reliability is consistency of scores obtained by the same individual when retested on the same or equivalent forms. The consistent results should be obtained when the test is re-administered. Another way to check the reliability is by dividing the test in two halves. All these methods to test the reliability are named as the types of the reliability, for e.g. test-retest, alternate form, split half, etc. Reliability is expressed in correlation coefficient. Such correlation should be from -1 to +1. In simple words, reliability is self-correlation of the test. C. Validity. The validity of a test indicates what test measure and how well it does so. If a test is measuring what it claims to measure, then it is a valid test. In simple words, validity is the correlation of the test with some outside criterion. Thus, for determining validity, correlation between performance on test and other independently observed behavior is examined. For example, the test that claims it measures anxiety should be able to give a near-perfect score of anxiety. There are different types of validity such as content validity, construct validity, criterion validity. D. Norms. This is the population on which the test is standardized. The scores obtained from such administration become the reference point for the interpretation of the test scores. The norms may differ from test to test. For example, if we are looking out for any phenomenon related to school difficulties, then obviously the norms are based on that age group and school-going children. The raw score of any test is meaningless unless compared with norms. There are different types of norms like age norms, sex norms, percentile norms, standard score norms, etc. A. Standardization. Standardization means uniformity of procedure. If scores of different individuals are comparable, the procedure should be same for all. The uniformity can be maintained in instruction, time, scoring, norms, reliability and validity. Hence, all the detailed information should be given by test constructors. Aiken, 2000, gave various purposes of using psychological tests: to screen applicants for job, to classify and place people in different contexts, to counsel and guide individuals, to diagnose problem, to evaluate cognitive, intrapersonal and interpersonal changes due to certain condition, to conduct research. 1.4.2 Classification of tests. The tests are classified on the basis of certain criteria. Some categories are given below. A. Individual and group tests. Individual tests are those in which the test administrator can use the test on only one person at a time. This gives us in-depth understanding of the subject. Most of the tests of intelligence come under this category. The advantage of this type of test is that this gives us more reliable results. But then the time consumed is too much in many cases. Group tests are those in which the same test can be administered to a group at the same time. In fact, there are certain tests which also have the norms of the test in the group format. Like the test of creativity. In this, group administration is more useful than the individual administration. Most of the paper-pencil tests belong to this category. These are the tests which have common instruction, and many times the tests are self-administering. That means the subject can administer the test on himself by just reading the instructions. B. Personality tests. As the name suggests, these are the tests that assess the personality of individuals. Personality tests are of many types, as for example, pencil paper test, storytelling test, ink blot tests, etc. One of the tests is 16 personality factors, or the 16PF test as it is popularly known. This test gives us understanding of the person on various aspects of his or her life, whether suffers from anxiety, depression, etc., and the level of intelligence that the person has. It must be remembered that the tests differ in their contents and structure depending on the factors that it measures. There are certain tests which are based on a particular model. For example, the NEO-PI is based on the 5-factor model. Eysenk's personality questionnaire is based on the 3-factor model. C. Projective tests. These are tests which try to unravel the unconscious material. In certain cases, it may happen that the client is not aware of certain aspects of his own mind. These tests help to understand such aspects. The unknown, unresolved conflicts and the motivational forces behind the actions are seen through these tests.
D. Achievement and aptitude tests. These are the tests which measure the person's motivation to achieve and other aspects of achievement. Aptitude test refers to the ability of the person to learn new things. A person may have aptitude of different skills. It may be aptitude for teaching, it may be aptitude for learning music, etc. Intelligence tests. The tests of intelligence measure different aspects of the intellect. There are different intelligence tests for different age groups. Also, the same test may be differently administered to the different age group individuals. F. Verbal and performance tests. Verbal test is that test which requires reading, writing and oral responses. Performance tests, on the other hand, emphasize on performing on some task rather than answer some questions. In such test, tasks like assembling puzzle, placing picture in correct sequence, pointing missing part, etc. are used. 1.5 Summary. Interview, case history and tests are mostly used as assessment tools in counseling. Interview may be structured or unstructured. It is used for various purposes from school admission to employment. Case history is a type of interview for gathering in-depth personal information. Mostly standard format of case history is used in counseling. Test is objective and standardized tool for measuring some human behavior, like personality, intelligence, attitude, aptitude, study habits, etc. Objectivity, reliability, validity, norms are characteristics of good test. Thank you. Subscribe to our channel for more updates, and we will see you with the next chapter.